Antibody testing has started at a specialist lab at Poole Hospital. This is a test that's used to detect antibodies to see if someone has had the COVID-19 virus. We can talk about this with Debbie Fleming, who is the Joint Chief Executive of... And Debbie, we're going to have to sort out this job title, Poole Hospital NHS Foundation Trust and the Royal Bournemouth and Christchurch Hospitals NHS Foundation Trusts. Debbie, good morning.
Good morning to you. Yes, indeed.
I'm sorry, that's all we've got time for this morning. No, great to have you on. So talk me through these antibody tests. This is something of a holy grail that we've heard an awful lot about over the past few months.
Surely. So, I think the first thing is to say the reason I really wanted to come on and speak to people this morning was just to really pay tribute to our absolutely fantastic healthcare scientists whose work is so critical in the NHS. These people are often not visible to the wider public, but they really deserve every clap that's been given for the NHS throughout the COVID period. So antibody testing. Now, this is the test that everybody wants, and it's always very exciting because it actually tells us whether or not someone has actually had COVID. But other than that, it's really important for us to remember it doesn't actually tell us much more at the moment. It tells us if we've got antibodies, but we really, really don't know much more. And over time, this will become really important. But just at the moment, people need to be really cautious.
Yes, because we don't know whether there's an immunity that is that follows on from somebody having had COVID and having those antibodies.
That's right. So if you've got the antibodies, then it's possible that you've got some immunity, but we don't know that, and we don't know how long people might have that. So the big fear is that everybody would change their practice or feel safe and suddenly just go back to normal because they've had this test. And of course, that's absolutely not the case. Over time, as we get more information about this, we will be able to see what this means, and that is going to be part of an ongoing programme run by Public Health England. But at this stage, what's really great is to have started it, and it's wonderful that Poole Hospital is one of the laboratories that's been able to do that on the behalf of Dorset and also for parts of Hampshire.
Yeah, and so the thinking here then is that as and when we get more information about what having those antibodies means, you will have a record of who has them and who might then, if it turns out to be that there is some immunity associated with having had COVID-19, those people will be on record as having that level of immunity.
Yes, and it'd be really interesting to see over time, won't it, as the retesting is done, as to how long that lasts. And it'd be very interesting to see over time whether any of these people actually develop COVID in different situations. So it'll be building our body of knowledge, and it's part of the government's national testing strategy. But it's very important to know what it does do and what it doesn't. The labs have actually done 13,500 tests in 2 weeks. That's 13,500 people who've had to have blood tests. So unlike the other tests, so if you have symptoms of coronavirus and you think you've got it, you need to have a swab test to find out if you've got it now, and then that will decide, what people do about that. This is very much a historical test. It tells you whether you've had it in the past. And it requires a blood test, so it's more. It's a little bit more work to it. People have to take the blood. It's got to be analysed, and then it's got to be reported.
But from what I hear of the swab test, it might even be preferable to give blood rather than have one of those dreadful swabs up your nose and down your throat. Look, fascinating. Stay in touch with us and let us know how that goes. I mean, staff, do they volunteer for that blood test? Is that where those numbers are coming from? They're coming forward and saying, "Well, test my blood."
So at the moment, the first stage of the programme is to ensure that all NHS staff get this test, because that's where we know that obviously people have been dealing with COVID. That's where people are most likely to perhaps have had it in the past. So we're testing all NHS staff. So that's all in the hospitals, the communities, GPs, optometrists, dentists and pharmacists. We're trying to get through all of the NHS staff. And then as part of the wider national programme, it will be rolled out further.
Cool.
Watch this space.
And just while you're on, Debbie, I wonder if you can just give us a bit of an overview on how things are from the people that I know who are working in some of Dorset's hospitals. Thankfully, the number of new cases of coronavirus seem to have really dropped off, and some of those areas that had been repurposed as intensive care wards and ventilator wards have been returned back to the day-to-day stuff that those hospitals tend to do.
I mean, it is wonderful, absolutely wonderful to see how things have settled down within the hospitals. Our staff have been amazing. It has been hugely busy and it continues to be busy in different ways. But as of yesterday, just yesterday, there were only 4 people with COVID actually on wards across both Poole and Bournemouth Hospital,
Wow.
which was amazing. And we've seen such great outcomes where we, of course, over time, we've actually had 380 cases admitted over the period. And the vast majority of those have been discharged home. We've seen some fantastic results with our patients. We've all clapped them when they've come out of intensive care, and our staff have been absolutely fabulous. The challenge now, of course, is that we want to get back to normal like everybody, but we have to do that safely. So we are making sure that we have got everything as much, people are now wearing masks in the hospital as part of the new national guidance everywhere, not just in the clinical areas. We've done a lot around social distancing, which is so important. And as we're expecting, as things settle even more, that we'll be able to bring more people back in for the operations and the treatments that we want to give. I have to say, though, it is complex because that we do have to remain on standby. We have to keep our staff trained. And of course, at the moment, we've still got a number of staff off who themselves might be shielding.
Yeah, and of course, an eye on that R number, which we've seen some concerns about in the past. Well, look, Debbie, we'll stay in touch and we'll keep talking. Appreciate you coming on this morning.
Indeed, and we'll keep working on that title.
Right, I'm going to do it again. Debbie Fleming, who is the Joint Chief Executive of Poole Hospital NHS Foundation Trust and the Royal Bournemouth and Christchurch Hospitals NHS Foundation Trust.